The Elusive Embrace of Sleep. A comprehensive guide to achieving sufficient rest. In our relentlessly paced modern lives, sleep often takes a backseat to deadlines, social engagements, and the ever-present glow of screens. We treat it as a luxury, a disposable commodity, rather than the fundamental biological necessity it truly is. However, neglecting sleep comes at a steep price, impacting everything from our physical health and cognitive function to our emotional well-being. Getting sufficient sleep is not merely about closing our eyes for a prescribed number of hours. It's about cultivating a restorative and consistent sleep pattern that allows our bodies and minds to regenerate. Understanding the importance of sleep. Sleep is not a passive state of inactivity. During sleep, our bodies engage in a complex series of processes essential for survival and optimal function. These include cellular repair and growth. Sleep allows our bodies to repair damaged tissues, regenerate cells, and strengthen the immune system. Hormone regulation. Crucial hormones, such as growth hormone, cortisol, and melatonin, are regulated during sleep, influencing metabolism, stress response, and sleep-wake cycles. Cognitive function. Sleep plays a vital role in memory consolidation, learning, and cognitive processing. Lack of sleep impairs attention, concentration, and decision-making. Emotional regulation. Sleep deprivation can lead to irritability, mood swings, and increased susceptibility to anxiety and depression. Cardiovascular health. Chronic sleep deprivation is linked to an increased risk of heart disease, high blood pressure, and stroke. How much sleep do we need? The ideal amount of sleep varies depending on age, individual needs, and lifestyle factors. However, general guidelines suggest adults 18-60 years, 7 to 9 hours per night. Adults 61-64 years, 7 to 8 hours per night. Adults 65 plus years, 7 to 8 hours per night. Teenagers 14-17 years, 8 to 10 hours per night. School-aged children 6-13 years, 9-11 hours per night. Preschoolers 3-5 years, 10 to 13 hours per night. Toddlers 1-2 years, 11 to 14 hours per night. Infants 4-12 months, 12 to 16 hours per night. Newborns 0-3 months, 14 to 17 hours per day. It's important to note that these are just guidelines, and some individuals may require more or less sleep to feel their best. Pay attention to your body's signals and aim for a sleep duration that leaves you feeling refreshed and energized. Strategies for improving sleep quality. Achieving sufficient sleep involves more than just spending time in bed. It requires cultivating healthy sleep habits and creating a conducive sleep environment. Here are some strategies to improve your sleep quality. Establish a regular sleep schedule. Go to bed and wake up at the same time every day, even on weekends, to regulate your body's natural sleep-wake cycle, circadian rhythm. Create a relaxing bedtime routine. Engage in calming activities before bed, such as taking a warm bath, reading a book, or listening to soothing music. Optimize your sleep environment. Ensure your bedroom is dark, quiet, and cool. Invest in comfortable bedding and blackout curtains if necessary. Limit screen time before bed. The blue light emitted from electronic devices can suppress melatonin production and disrupt sleep. Avoid screens for at least an hour before bedtime. Avoid caffeine and alcohol before bed. These substances can interfere with sleep quality. Limit their consumption, especially in the hours leading up to bedtime. Get regular exercise. Physical activity can improve sleep quality, but avoid exercising too close to bedtime. Expose yourself to sunlight. Sunlight helps regulate your circadian rhythm. Aim for at least 15 minutes of sunlight exposure each day, especially in the morning. Manage stress. Stress can significantly impact sleep. Practice relaxation techniques, such as deep breathing, meditation, or yoga. Consider cognitive behavioral therapy for insomnia, CBTI. If you struggle with chronic insomnia, CBTI can help you identify and change negative sleep-related thoughts and behaviors. Evaluate your diet. A healthy diet can improve sleep. Avoid large meals before sleeping. Stay hydrated. Dehydration can negatively impact sleep. When to seek professional help. If you consistently struggle with sleep, despite implementing healthy sleep habits, it's essential to seek professional help. A healthcare provider can evaluate your sleep patterns, identify any underlying medical conditions, and recommend appropriate treatment options. The ripple effect of sufficient sleep. The benefits of sufficient sleep extend far beyond feeling rested. Consistent, quality sleep can enhance physical health, strengthened immune system, reduced risk of chronic diseases, improved cardiovascular health. Cognitive function, enhanced memory, improved concentration, increased creativity. Emotional well-being, reduced stress, improved mood, increased resilience. Productivity and performance, increased energy levels, improved focus, enhanced decision-making. Overall quality of life, increased sense of well-being, improved relationships, greater enjoyment of daily activities. In a world that often prioritizes productivity over well-being, prioritizing sleep is an act of self-care and a crucial investment in our overall health and happiness. By cultivating healthy sleep habits and creating a conducive sleep environment, we can unlock the transformative power of restorative sleep and reap the countless benefits it provides. Overall quality of life by enough sleeping. The impact of sufficient sleep on overall quality of life is profound and multifaceted. It extends far beyond simply feeling rested, influencing various aspects of our well-being. Here's a breakdown of how adequate sleep contributes to a better quality of life. Enhanced physical health. Immune system support. Sleep plays a crucial role in strengthening the immune system. Adequate rest allows the body to produce cytokines, proteins that help fight infection and inflammation. Consistent sleep reduces susceptibility to illnesses, leading to fewer sick days and a healthier overall physical state. Cardiovascular health. Sufficient sleep helps regulate blood pressure and reduces the risk of cardiovascular diseases such as heart disease and stroke. It allows the heart and blood vessels to rest and repair, promoting optimal function. Metabolic regulation. Sleep influences hormone regulation, including those that control appetite and metabolism. Adequate sleep helps maintain a healthy weight and reduces the risk of type 2 diabetes. Physical recovery. During sleep, the body repairs tissues and muscles, promoting faster recovery from physical exertion. This is particularly important for athletes and individuals engaged in physically demanding activities. Improved cognitive function. Enhanced memory and learning. Sleep is essential for memory consolidation, the process of transferring information. Adequate sleep improves learning abilities, concentration, and problem-solving skills. Increased mental clarity and focus. Sufficient sleep enhances cognitive function, leading to improved mental clarity, focus, and attention span. This translates to increased productivity and efficiency in daily tasks. Emotional regulation. Sleep plays a crucial role in regulating emotions. Lack of sleep can lead to irritability, mood swings, and increased susceptibility to stress, anxiety, and depression. Adequate sleep promotes emotional stability, resilience, and a positive outlook. Enhanced psychological and social well-being. Reduced stress and anxiety. Adequate sleep helps regulate the body's stress response, reducing the production of cortisol, the stress hormone. This promotes a sense of calm and well-being. Improved mood and emotional stability. Sufficient sleep contributes to a more positive mood, reducing the risk of depression and anxiety. It enhances emotional resilience, making it easier to cope with daily stressors. Improved social interactions. When well rested, individuals tend to be more patient, empathetic, and socially engaged. Adequate sleep promotes healthier relationships and improved social interactions. Increased overall life satisfaction. When an individual is receiving adequate sleep, they are more likely to have higher energy levels, and a more positive outlook on life, which increases overall life satisfaction. In essence, prioritizing sleep is an investment in your overall well-being. It allows you to function at your best, both physically and mentally, leading to a more fulfilling and enjoyable life.